I'm going to start recording in 1 minute. So everybody,
Get it out.
be on your best behavior now.
Oh.
Okay, so we're in the live classroom, and this is Mark. And Mark has agreed to be recorded, so Mark's going to say his name, and this is Andrea Brennan, adjunct faculty for physical assessment, and we're going to go over how to do a neurological assessment. Mark, could you please say your name and say that it's okay for us to record you today?
Hi, I'm Mark, and yes, it's okay to be recorded.
Is that your full name, Mark?
No. Mark Allen Sipes.
Thank you, Mark. The class appreciates Mark for volunteering to be recorded today. So, we're going to go over the neurological assessment. So first, as with last week, when you talk to the patient, as long as you explain the procedure and you tell them that you're going to be doing an assessment, as long as you explain to them that you're going to be touching them, and they say that it's okay, you don't have to constantly ask them if it's okay to touch them, okay? So you're going to knock on the door, or if the room's open, you're going to introduce yourself and say who you are to the patient and say, hello, Mark. You're going to say your name and introduce yourself, say who you are, say you're here today to perform a neurological assessment, and that's going to require me to touch certain parts of your body today and examine you from the head to your toes to check the neurological system. Is that okay with you, Mark?
That's fine.
Are you sure?
Yes.
Okay. I don't know if that was okay, but I'm going to wash my hands and assume since he said it was okay, that it's okay. So I'm going to wash my hands now. I'm going to provide privacy, whether that's closing the door, closing the curtain. He is in a locked seated position. We'll pretend he's not in a chair that rolls. So we're making sure that he is safe in his environment. We're going to ask him his name and date of birth, please. You don't have to say your date of birth. You can just say date of birth if you don't want to tell us. I know you already said that you were going to turn 50 and you weren't looking forward to it this year.
Mark Allen Sipes, February 11th, 1973.
Oh, that's a year away. Oh, almost. No, okay. All right, sorry for that. So, all right. Well, we have to have humor in class just to make it a little bit more fun. Okay. So again, I'm going to be performing a neurological assessment on you today, and that requires examining you from your head to your toes, and that does require some touching and shining a light some places. Is that okay with you?
That's perfect.
Okay. If at any point you're uncomfortable with me touching you or asking you to do something, will you just please let me know?
Sure.
Okay. All right. So, now we pretty much already by talking to him assess level of consciousness. He's awake and alert. He's kind of looked at me, but he's being quite serious too. So, we did just get him to laugh though. So, you're going to ask him where he is.
I'm a Rasmussen.
Thank you for that. Do you know what day of the week it is today?
It is Wednesday.
Do you know what the date is today?
It is the 16th.
It's the 16th. Oh, I guess he's disoriented. Do you know what year it is?
2022.
Do you know who the president is?
Yes.
Could you tell me his name?
Yes.
You just asked me if I knew who he was. You didn't ask me to say who he was.
Okay. All right. So sometimes when you're asking in real life patients questions, they get tired of asking the same old questions. So sometimes you want to change it up. So by asking them those orientation questions, I've already assessed his speech to be clear. Sometimes you want to ask them to repeat a phrase or words. Sometimes like, can you say no ifs, ands, or buts?
No, you found about it.
So you can see if they can say it clearly, because asking them to say something that's a little hard, you will notice if their speech is slurred or not. So his speech is clear, fluent, and yes, you can say appropriate for this, and you can write appropriate in your assignment, because there's nothing else that you can really say for saying that the speech is appropriate. unfortunately. So I did not make up the grading group, okay? And the speech is clear and fluent, okay? Are you laughing at him or at Mark? Okay. Sure.
For that one, all we have to say then is, once we have them talk, all we have to say is speech is appropriate?
No, the patient is awake, alert, oriented to person, place, and time, and speech is clear, fluent, and appropriate to the situation. Sorry.
I can't even write notes about
And that would be for those two. Sorry.
Say, can you just say it one more time?
Patient is awake, alert, oriented to person, place, and time. Speech is clear, fluent, and appropriate to situation. Yes, please just remind me. So you're gonna check cranial nerve 1 olfactory. So I need to check your smelling. Can you close your eyes and cover your left nostril? Can you tell me what I put under your nose?
Nothing.
Just pretend, please.
Okay. 11.
Okay, and the other side? It was vanilla this time. Okay, thank you.
So when you go to test that, you have to say, can you say, I'm testing the cranial nerve 1, or you have to say olfactory, or both?
I'm gonna go over that right now.
Okay.
So you can just tell them you're gonna check smell or whatever.
Okay.
And I'm gonna ask you to smell something, and then you're gonna say, you can say nares are patent bilaterally with differentiating ability to smell. Cranial nerve 1 olfactory is intact. You can say it an easier way. Patient is able to smell in both nostrils or both nares bilaterally. Cranial nerve 1 olfactory is intact. You can say differentiate the smells, whichever is easiest for you. For the optic nerve or visual nerve as they have it named here, cranial nerve 2, you can do the Snellen chart, which you already have done, with asking him to cover one eye, and then the other eye, and then both eyes, and reading the lowest line, which would be stating the vision is 20/20 bilaterally, cranial nerve 2, optic nerve is intact, or saying the visual nerve, whichever you prefer. Or you can do confrontation chest for the peripheral vision. You do not have to do both. So normally, in the hospital setting, we don't have a good Snellen chart. People forget to bring their little copy, so we do peripheral vision testing. So I'm just gonna have you turn this way, Mark. They're so serious sometimes, and you wanna be eye level with them. So you're gonna look at my nose, and then I'm gonna hold up fingers. Make me laugh. Tell me how many fingers I'm holding up.
1 on each side. 2 across the hip. 2 and 1 pointed straight at 4.
Okay. And then you kind of alternate them in different locations on the video. Sometimes people say cover one eye. Cover one eye. Simon says. How many fingers?
2. 1 pointed towards me. 2.
Okay, and then you would do that with the other eye. And sometimes people come in from the sides with one eye covered and then cover the other eye. There's a variety of different ways to test it, so whichever you prefer. Okay? Sometimes it's easier just to do visual acuity because you've already learned that for that. Next, you're gonna test 3, 4, and 6. So again, that's Perla and the cranial nerve gazes, cardinal gazes. So we've already learned that, so I'm gonna have you sit straight and you can lift your glasses up for a second. Thank you. Then you're gonna look at my pen light. And you come out, you go in, and then can you follow this for me? And remember, don't go like this. It's not very nice. You guys get nervous. And you do your X, and I usually go up and down, but that's me. And then you can say, you can put your glasses back on, Simon says. Cranial nerve 3, 4, and 6 are intact, oculomotor, trochlear, and abducens.
You have to say all that?
Pupils are equal round reactors to light and accommodation.
Cause it, that's gonna be the hard part. Remembering their names too.
So you gotta say all the names of the.
We can't just kill them?
You have to know the cranial nerves.
So cranial nerve 3, 4, and 6 intact, and then what?
You have to name the cranial nerves.
Oh, we do want, I thought you said we could do either.
Now you have to know the names of the cranial nerves. For the, if you forget the numbers, that's fine for demonstration purpose, I will let that go. But you need to know the numbers for the quiz, because the quiz doesn't always go by the name, I believe. I will double check for you. All right. Then you can check jaw strength by asking, can you open and close your mouth? And then you can check them, can you open your mouth? And okay, so that's jaw strength for trigeminal nerve. And then you're going to check all the distributions. Remember, there's 3 for the trigeminal nerve. Can you close your eyes and point to where I'm touching you? And you can say facial sensation is intact bilaterally, upper and lower, or just facial sensation is intact, and jaw strength is equal bilaterally, cranial nerve 5, trigeminal nerve is intact. You got the giggly group in the back. Okay. Can you smile for me, Mark? Good. Can you puff out your cheeks? Can you raise up your eyebrows? Can you close your eyes? If you really wanted to check more strength in a hospital patient, if you're suspecting weakness, you would push on their cheeks to see if there's any weakness and try to disrupt the air in there too. Thank you. So that was the facial nerve. So that's cranial nerve 7 is intact bilaterally, upper and lower. And it's symmetric bilaterally. Okay? So acoustic, vestibular cochlear, that's your whisper test or finger rub. Most of you all did the finger rub. So you'll come behind them. Can you close your eyes for me? Can you tell me which side you hear it on? Okay. And then you would say, hearing is intact bilaterally, acoustic nerve is intact, which is cranial nerve 8. Okay? So glossopharyngeal, you check for swallowing. So that's cranial nerve 9. So just like when you were checking thyroid and you were asking them to swallow so you can feel the thyroid gland, you're just gonna put your hand gently over there and can you swallow please? And you would say swallowing is intact, cranial nerve 9 is intact, glossopharyngeal. Okay? All right. some people like to do that with 10 and 12 and do them all at the same time, whichever is easiest for you. Remember, you don't necessarily have to follow the order on the paper, like I said before, or you could go back. So sometimes asking for the tongue movement or asking them to stick out the tongue and looking at the uvula at the same time is easier for some people. So whatever flow gets you going or following it. So, all right, open your mouth, say ah. Stick out your tongue, please. Say ah. All right, uvula is midline, rises with phonation, tongue is midline, and protrudes midline. And so, for the uvula rises with phonation, that's cranial nerve 10, that's the vagus nerve, so that was intact. For 12, it was hypoglossal, and the tongue protruded midline. Okay, so that one was intact. And then spinal accessory is the head, neck, and shoulder movements. So can you shrug your shoulders up for me? Okay, can you turn over here? This way. Thank you. Okay, so head, neck, and shoulder movements are bilaterally symmetric, 5/5. So spinal accessory, cranial nerve 11 is intact. Okay. All right. Now you have to use the hammer. Okay. All right. So for your bicep, you're going to feel the tendon right here. Okay. You don't always see much movement in the arms like you do the knees, but you should try to relax if you can. And then just let your arm hang there. But you should see some movement there. Okay? And then you let this tongue go limp there. And then sometimes the arm, try to let it go limp. There you go. There you go. You see some extension out there? You gotta get people to relax. If you feel them not going limp, you know, and letting their arm really hang in your arms, you'll never get anything there. This is the brachioradialis. The last one was the tricep. Try to let it just, and then you're just gonna, and sometimes this is just more the thumb, just a little bit, so, okay. Then you do both sides. And then you would say the bicep, the tricep, the brachioradialis are 2+ and intact, but you need to name them as you're doing them, so I know you know which ones are which ones. And then there's the good old knee one. Do not stand in front of the person, especially a male. You might get kicked somewhere if you do the knee reflex. So you want to hit just below the patellar. You can feel if you haven't done it before, and get that knee reflex. Although let's see if we can get the hammer to go down there. All right, so here you go. All right, so you don't want to stand in front, because if somebody has a swift reflex, some neurologists have been known to get kicked somewhere. All right, you might crease your joints, will bend over now. All right, so for the ankle one, relax your foot. Relax. You're gonna kick, you're gonna hit. See, I'm afraid of getting kicked by them. You're gonna hit the back behind the ankle and hit where the Achilles is. And then usually he's not relaxed enough. All right. You got back problem? Try to relax. Let me see the other one. Relax. Try to pull your hands apart. Put your hands together like this and try to pull them apart. Keep trying to do that and relax. Relax. It's not moving very much. You might be dead. Sometimes if you can't get people to relax, it's very hard to get.
During our demonstration, say we can't get any reflex, do we have to keep trying until we get a reflex?
No.
Okay.
Some reflexes are very hard to get.
Okay.
As you saw, it took me more than once to get him to relax, to get the reflexes. And it was hard to get the ankle.
So you just say intact bilaterally?
2+, so it's
2+.
patellar and the Achilles are 2+ bilaterally. Now, let me wash my hands for a second here. I don't know where his shoes have been.
Only on the floor.
What floors though? What went on those floors? Okay, so patellar's the knee, Achilles is at the ankle, and they're 2+ bilaterally, or intact, 2+ bilaterally, whatever you want to say.
That's for all of the reflexes, right? Is 2+
Yeah.
is normal, perfect, whatever?
Yes. You just have to memorize normal. Pretend all your patients are normal for the purpose of the demonstration. You have to know the abnormals for the quiz. We're going to pretend this is the bottom of the foot, this is his big toe, and this is his small toe. So for the Babinski, you're going to run like this, up and over, and this toe should stay down. So Babinski is negative. Okay? For the plantar reflex, you check the plantar reflex. If the toe goes up, then it's abnormal and it'll be positive Babinski. Okay?
Are we gonna be demonstrating on the hand such as that? Or are we gonna be barefoot?
I really don't want to smell people's feet. Whatever you people prefer.
Sun's out, toes out.
I can pull a mannequin into the room and you can demonstrate on the bottom of the mannequin's foot. Okay?
So you would say positive,
It's negative Babinski.
Negative.
The plantar reflex is a negative Babinski bilaterally.
So do we have to do it on both feet or just one and say bilateral?
You can do it on one side as long as you were saying you tested it bilaterally.
Okay.
Babinski negative bilaterally.
Correct.
No 2+ on that one.
Correct. That one is negative Babinski. The others, the patellar, the Achilles, the brachioradialis, bicep, tricep is 2+. You got all that?
Sure.
All right, you ready to be tested right now? You're ready to go.
I don't know.
2 points?
I don't know.
You gotta have humor. So finger to nose, I kind of went over that a little bit in class. Can you take your right hand? Look, I didn't even tell him what to do. Simon didn't tell him yet. All right, take your finger, go back and forth. Keep going. All right, left hand.
You're barely touching her.
She moves her hand up.
That's the point. This is, he's right-handed, obviously.
You gotta be quicker than that.
So that's finger to nose. He's right-handed, obviously. He was a little slower with his left hand. So finger to nose is accurate bilaterally. Okay? Then can you take the heel of your foot and run it up and down your shin from the top to the bottom? And can you do it on the other side? Okay, so heel to shin is accurate bilaterally. Oh, I forgot. Well, I'm sorry. Can you do it again for the purpose of the camera, Mark, please? They need to go home and watch you on camera. All right, so the Romberg test. Can you please stand, Mark? Put your 2 feet together, do not fall. And you would count to 20 with his eyes closed fully and his hands by his side. 1, 2, 20. He did that wonderfully, didn't he? He knew how to stand with his feet together and not say a word. Sit down, Mark, please. We have to have humor around here, don't we? Humor is the best medicine.
On occasion.
On occasion? No? Oh, come on. All right. So, Romberg test was negative. You do not have to check gait for this one, but when you get to the head to toe one, you do. Okay? So you're going to check grip strength. 2 fingers, like when I went over musculoskeletal, because you want to be able to pull your hands out if somebody doesn't want to let go. Okay? Can you squeeze my hand? Hard, 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 hard. And believe it, that's all you have to test for motor testing for the neurological demonstration. Even though there's a lot more important things in testing someone's neurological assessment. So grip strength is 5/5 bilaterally. And then I am not going to do the feet again because then I'll have to wash my hands. So dorsiflexion is when you pull your foot up. Can you pull your foot up, Mark? Okay, thank you, Mark. Up is dorsiflexion and down is plantar flexion, and you would do that with resistance. And you guys can do that on the mannequin, and that would be 5/5 strength bilaterally. So you would be pushing against resistance. So dorsiflexion is when you pull the toes upward, and plantar flexion is like pushing on the gas, pushing the foot down. Okay? Questions about that part so far?
That's only for the feet, or you gotta do it for the hands too?
No, that's just for the feet. I'm just demonstrating with my hands because I don't want to keep washing my hands after touching shoes. Then you're going to check sharp and dull on 2 spots on the arms and 2 spots on the legs each side. Okay? So, okay, so this is sharp and this is dull.
Yep.
Can you close your eyes? All right, tell me if this is sharp or dull.
Dull.
Okay.
Dull. Sharp. Dull. Dull.
Okay. And then sharp.
And dull.
Okay. And then sharp.
And then dull.
Okay. Yeah, it's hard to feel through clothes, so sometimes, you know, when you're doing it, you just have to move on if your person says the wrong thing, because we're not gonna undress people, okay? So, you do, and then you would say, sensation is intact to sharp and dull bilaterally in upper and lower extremities. And then proprioception is moving the finger and toe up or down. So you do 1 finger on each hand. Can you close your eyes? Can you tell me if this is up or down?
Down. Up. Up. Down.
And then you would take a toe, which you can do on the mannequin, and do the same thing.
Down. Up.
Were you cheating? You had your eyes open?
No.
Okay. He had his eyes open again. I don't know that he was a cooperative patient. All right, and you're nice and pleasant and explained everything to your patient, and you were cooperative, and he was cooperative, or she was cooperative. And you give everything back, you give them the call light, you open the curtain, you open the door, you wash your hands, and I don't think I mentioned anything else out of the closing part. Did I, Mark?
Yep.
Did I forget anything? You don't know?
Pull the curtain.
I said
Wash
that.
your hands.
I said to pull the curtain or open the door.
He's the long, he's the second.
I said I'd give him the call
I
light.
didn't hear it, so I wasn't paying attention.
Wow, now. You told me, Michelle, you were not giving me any trouble today.
For the last one that you mentioned, what's the proper way to say for it?
Position sense is intact bilaterally or proprioception. Sorry. All right. All right, I'm going to stop recording. Thank you, Mark.
Thank you, Mark.